Have you ever found yourself suddenly overwhelmed by fear? Your heart starts racing, your breath quickens, and there seems to be no clear way out of this situation. It might be more than just anxiety. You might be experiencing a panic attack. Hi, my name is Dr. Victoria Meng, a resident physician in psychiatry at the Ottawa Hospital. In this video, let's explore panic disorder, its causes, signs, and some strategies to overcome panic attacks if and when they happen. Panic disorder goes beyond just occasional anxiety. It's characterized by a sudden wave of fear, often without even a clear trigger. Imagine walking calmly through a store, looking for your favorite snacks, only to suddenly feel like you're being chased by a T-Rex. Your body responds as if there's real danger when there isn't. When panic attacks become frequent and disrupt daily life, it's known as a panic disorder. So, how do we know if we're having normal anxiety or if it's something more? That brings us to our next point. Panic disorder symptoms are intense and often confused with other conditions. During a panic attack, you might feel chest tightness, a racing heart, dizziness, or even shortness of breath, like a wave of fear out of nowhere. Anxiety builds gradually, often feeling tense or worried, but less intense and more prolonged in time. Panic attacks, however, are sudden and severe, taking you from calm to fear within seconds or minutes. Panic attacks can often mimic heart attack symptoms, like chest pain and shortness of breath, but there are some key differences. For example, heart attacks involve pain radiating often to the jaw or the arm, as well as cold sweats and breathlessness even at rest. Panic attacks, on the other hand, peak quickly with this feeling of impending doom. If you're unsure, it's always safest to seek medical attention. Panic attacks can be triggered by specific situations like crowded spaces, or they can strike without a warning. Our brains have evolved over time to trigger a fight or flight response to physical threats, but today's threats are often psychological, like stress or social anxiety, causing panic over non-physically dangerous situations. By avoiding situations that you associate with panic, however, it can actually reinforce fear and create a cycle of avoidance. Instead, calmly confronting these triggers can help to break the cycle and reduce that sensation of panic over time. Now, let's discuss some strategies to cope when panic strikes. When a panic attack hits, it can often feel very overwhelming, but staying calm and curious can help. First, find a quiet space where you can focus. Ground yourself with the 5, 4, 3, 2, 1 technique. Name 5 things you can see, 4 things you can touch, 3 things you hear, 2 things you smell, and 1 thing you can taste. The order doesn't really matter. And this brings our attention to the present. Sit down, place your feet flat on the earth, and focus on slowing your breathing. Inhale for 4 counts, exhale for 6. The longer exhale signals safety to your body. Stay curious about what triggered the attack. Ask yourself, what was I feeling before this? Or is this a real threat, or is it just my body reacting to something else? And lastly, remember to label your sensations, like my heart is racing or I feel scared. Naming them reduces their impact and gives you back some of that control. Remember, staying calm and curious helps to manage panic. If panic attacks are or begin to disrupt your daily life, treatment can often help. Talk therapy like CBT or cognitive behavioral therapy is effective in reducing the frequency and severity of panic and anxiety. Medications like SSRIs can also be helpful, especially when panic disorder coexists with depression or other anxiety disorders. Along with these treatments, regularly practicing calming techniques can improve your quality of life and help you regain control over your stress and symptoms. Panic disorder can feel very overwhelming, but remember, you're not powerless. Managing panic attacks, distinguishing them from medical concerns, and seeking help are key steps towards recovery. If panic attacks are affecting your daily life, professional help can make a big difference. Remember, seeking help is a sign of strength. You are not alone. Thank you for watching.